The mission of our Pediatric Urology program at UT Southwestern and Children's Medical Center is improving surgeries and improving surgeons. It was dissatisfaction with the appearance after distal hypospadias repair that resulted in a technical modification that created the TIP procedure. I moved to Dallas in 1999 to explore the boundaries of this new operation and began prospectively collecting data on consecutive patients undergoing this operation. Periodic review of those outcomes identified other factors that could be modified to both improve the outcomes from surgery and me as a surgeon. From these beginnings, we've developed a comprehensive clinical, academic, and training program for the surgery of distal, proximal, and reoperative hypospadias.
With more than a decade's worth of prospectively collected data, we apply appropriate statistical analyses that enable us to isolate these factors and improve surgical outcomes.
And we've applied these lessons to our entire pediatric urology program.
Another example has been our bladder neck surgery in children with spina bifida. When we analyzed our results with the bladder neck sling, we realized that 50% of these children were still wet. And so now we've actually modified our surgical technique. By narrowing the bladder outlet before placement of the sling, we've discovered that our continence rates have improved by more than threefold. And recent review of our prospective database shows that this improved continence is durable.
So the next step in the evolution of this procedure was to determine whether or not this procedure could be done robotically with the same outcomes as we have seen in open surgery. The short answer is yes, and because of this, we do this procedure exclusively with the robot. Robotic surgeries further our goal of improving cosmesis in children, and to this extent, we actually perform all kidney procedures, including pyeloplasties, by hiding the incisions down at the bikini line. This is called the HIDES procedure, which we pioneered here, and this has made it possible so that these children have absolutely no visible scars in their abdomen as they grow older.
Our emphasis on cosmesis and function has led us to think about children with all types of urologic anomalies. For example, children with ambiguous genitalia or with significant vaginal anomalies require types of vaginoplasty. In the past, these have been done with skin or with bowel reconstruction, but these have significant drawbacks. Looking for a better tissue and a minimally invasive approach for vaginoplasty, I chose oral mucosa. It is really an ideal tissue for this type of surgery. It leaves no visible scars. The color and texture are near perfect match for vagina. There is minimal mucus production, and histologically it's almost identical to vagina. In addition, there is lubrication sufficient for intercourse.
Another innovation is placing a testicular prosthesis at the time of orchiectomy for torsion. I began the surgery when I had a patient who was distraught about the appearance of his scrotal asymmetry after he'd had a testis removed. This affected his social interaction, and he had difficulty speaking with his peers or changing in a locker room. His life completely changed when I placed a prosthesis. After this case, I decided that no boy should have a period of potential embarrassment from a missing testicle. So now, when we have a boy that has her testis removed for testicular torsion, we'll place a prosthesis at the exact same time. This is now our standard of care for surgery. As you've seen, we found many ways to improve surgeries in pediatric urology, from complex hypospadias to something as simple as placing a testis prosthesis at the time of orchiectomy for torsion. We prospectively collect data so we know our specific complication rates, and we design clinical studies and analyze outcomes so that others can take the lessons we have learned and apply them to their own practices.
These few examples illustrate the central mission of our Pediatric Urology program at Children's Medical Center, Dallas, improving surgeries and improving surgeons.